And with that, I'd like to introduce to you someone who shares the same passion and enthusiasm for your work as the President, Senior Advisor to the President, Valerie Jarrett.
Well, good morning, everyone. We are delighted to have you here. Thank you, Romano, for that great introduction and for all of your hard work. I just had a chance to meet our Champions for Change. This is one of my favorite events that we do here in the White House because it gives us the opportunity to recognize people from all over the country, ordinary people who are just doing extraordinary things. And for this event, we had over 900 submissions, and we came up with 8 extraordinary people. And I'm going to embarrass them and ask them to stand so we can all give them a round of applause. Thank you. So each of these individuals have excelled in the area of preventive and public health. And that is so important to us. And as we move into the next phase of the implementation of the Affordable Care Act, I think everyone here knows that beginning October 1st, we can enroll in the Affordable Care Act. Anyone who doesn't have health insurance can enroll in it. And preventive and public health is an extremely important part of the Affordable Care Act. And the folks who are here in this room are working in areas of trying to help support healthy eating, physical activity, the First Lady's Let's Move initiative, making it fun to make sure we take care of our bodies, living tobacco-free, helping Americans get preventive care so that we make sure that our emergency rooms are not used as primary care physicians. We want to make sure that everyone stays as healthy as possible and gets regular checkups and make sure that we're doing everything within our ability to take care of our bodies. On the public health side of it, one of the very important components of the Affordable Care Act is to make sure that we collect important data to get rid of health disparities. We still see around the country too many health disparities, and so that's something that's important to us as well. In the course of the day, you're going to hear a great deal about some of the important prevention activities that we have going on, the preventive fund investments, as well as other new programs to tackle the tobacco epidemic and promote healthy living and prevent disease. You're also going to hear about the valuable role that the public health community plays to continue in our ACA enrollment activities to build a healthy America. In a country as rich as ours, there's no reason why every single one of our Americans can't have affordable, quality health care. And I hope you all would agree with me on that. So I will shamelessly promote our healthcare.gov site. Anyone who's here, anyone who's watching as we stream online, please go on and you're going to learn everything you need to know about signing up and the importance of having health insurance coverage. So we applaud everyone who's here from the public health community for what you do each and every day, the champions who we have a chance to highlight, the important panel that we're going to have where we hope that we can inform you and those who are watching about the importance of both public and preventive health care. And so now I have the honor of introducing our Assistant Secretary for the Department of Health and Human Services, Dr. Koh. So please come up and enjoy the day, everybody.
Thank you so much, Senior Advisor Jarrett. We're just so thrilled to have you here and to have your presence and your dedication to prevention and public health. And I'm absolutely delighted to welcome all of you to the White House and to Washington and to share with you on the extraordinary celebration that this day represents. It's so wonderful to see our champions and our leaders here because being a champion and a leader is not easy. And it's especially tough when you're trying to do it in an area like prevention. We all know that prevention is not as dramatic a field as treatment. Some would say that when prevention works, nothing happens. One of my favorite sayings is from Dr. June Osborne, who once said, "When prevention works, absolutely nothing happens and things are very boring, ... Let us all pray for a little boredom." And I know that you all appreciate that and recognize that and are passionate about this concept of prevention in public health, because at the core of this concept is the understanding that our good health is a gift. It is precious, it's fragile, it is sacred, and the only way to protect that gift is through prevention and public health, and to celebrate the work of so many of you here and so many others across the country. These are lessons I learned as a physician who cared for patients for over 30 years and trained in multiple fields. As I wrestled with understanding the mysteries of sickness and death, I saw time and again where people suffered and died from preventable conditions. And it became clear to me early on that we needed greater focus on prevention and public health. And then I was very fortunate in my career to become a state health official, the Commissioner of Public Health from Massachusetts from 1997 to 2003, multiple governors, by the way, and got to see for the first time how prevention can have power when it's implemented at the population level. And I got to witness many champions in that state who inspired us and mobilized people to want to reach for higher aspirations. I spent a lot of time in my career as a professor and as a researcher, most recently at Harvard, again focusing on community-based prevention. I learned they call it research because you search over and over and over again. And now it's my thrill to welcome you here as the Assistant Secretary, because in this post I get to see historic advances in prevention and public health led by you and champions like you across the country. As you know, and as you heard from Valerie Jarrett, we are in a momentous period of public health history right now, with open enrollment in marketplaces starting in just a couple weeks. I hope all of you have visited healthcare.gov. I hope all of you have referred people to our 1-800 call center, 1-800-318-2596, with information that can be delivered in over 150 languages, 24/7. You all know that one of the great promises of health reform is the promise of better prevention at the individual, community, and national levels, and we're celebrating that today. And so, for example, for the individual, you know that health reform removes cost as a barrier to high-value preventive services. We don't want any type of cost or copay deterring people from having access to the prevention they need and deserve. So this historic law has removed those barriers, already making such benefits accessible to some 71 million people in new private plans. At the community level, we are celebrating tremendous progress that's led by many of you on efforts attacking issues like tobacco control, obesity, and elimination of health disparities. Next month, we'll be celebrating the 5th year of unprecedented resources from the Prevention and Public Health Fund, and we thank you for using those resources in valuable ways. And then on the national level, you know that we have a new National Prevention Council and a new National Prevention Strategy that we are implementing every day. We are thrilled at this national coordination on prevention because it builds on the progress of Healthy People. I have the great honor of overseeing that time-honored process in my current capacity, and also stressing the theme of the social determinants of health, because we all know that health is much more than what happens to you in a doctor's office. Health starts where people live, labor, learn, play, and pray. I made that up, so I'll say it again. Health starts where people live, labor, learn, play, and pray. And as one of my colleagues once said, it's not just about the goldfish, it's also about the water. That's what the health determinants, the social determinants, is all about. So this new National Prevention Council implementing the strategy involves some 20 executive departments and agencies throughout federal government committed to prevention and wellness. It's chaired currently by our acting Surgeon General, Boris Lushniak, who's in the audience today, so we thank him and that office for their leadership. We are thrilled that departments like Housing and Urban Development, Education, the Environmental Protection Agency, and others have joined in on making prevention and public health such a high priority. And for those of you who have looked at the strategy, and I hope all of you have, there are 4 overall strategic directions: to promote healthy and safe community environments, to promote the uptake of clinical and community preventive services, to have empowered people, and to eliminate health disparities. This last theme is so critical to all of us as our country gets more diverse. It's an area that is one of great commitment and passion for me personally as an Asian American and as a son of immigrants. And I love the phrase from Reverend Martin Luther King, who once said that he wanted each person to enjoy what he called the sunlight of opportunity. I love that phrase. And that's what elimination of health disparities is all about. So we now have a very vibrant National Prevention Council action plan. You all have access to this new infographic that celebrates some progress in these areas. Just as one example, we're thrilled that more than 1,100 college campuses nationwide are now fully tobacco-free. So that's an example of leadership at the local level that we are thrilled to celebrate. As a former state health official, I am very proud that states like Virginia are making these strategies come alive at the state level. Virginia has funded some 38 projects that center around the National Prevention Strategy. There's another group in Detroit promoting Healthy Detroit that's implementing the prevention strategy in that city environment. You're going to be hearing much more about all these examples of leadership and change for prevention in community after community, and we are very, very proud of you. As I close, this is really a forum to share lessons about leadership, a concept that we all embrace and study and aspire to improve in. The leadership experts have written that some of the key features for champions and leaders are to inspire a shared vision, to celebrate values and victories, that's what this event is all about, and fundamentally to encourage the heart. I love that phrase too, because it's one thing to be an individual doing your work, but fundamentally you have to encourage the heart of others around you. And when you do it in prevention, it makes such a difference, because when prevention works, you get to enjoy yet another beautiful day like today. When prevention works, you have some more time with the people you love and your family. When prevention works, you get to see your kids grow up and be strong and vibrant and have kids of their own. And when prevention works, you get to enjoy the miracle, the absolute miracle of a perfectly healthy, normal day. And that's what this celebration is all about. So thank you very, very much, and thank you especially to all the champions that are here. So I have the great pleasure of introducing a number of other leaders here in the administration who will be addressing you and interacting with you over the next period of time here. And the first one is my colleague, Dr. Tom Frieden, who is the director of the Centers for Disease Control and Prevention, the CDC. Dr. Frieden has occupied that post since 2009 and is working to control health threats from all around the country and indeed even around the world on infectious disease, on emergencies, in addressing the leading causes of death in our nation and globally. He was also the previous Commissioner of Health in New York City, where he had tremendous experience working in areas of infectious disease, tuberculosis, tobacco control, and many, many other areas. So please welcome Dr. Tom Frieden of the CDC.
Thank you so much, Dr. Koh. It's so great to be here with you. As Dr. Koh said, one of the striking things about prevention is that when it's successful, sometimes nobody notices. But today, we're noticing. Because what you do really does change the world, one person, one family, one community at a time. And that's the way change happens. So congratulations on being recognized and celebrated as champions of change. I want to welcome again everyone to the White House, especially our distinguished awardees. Thanks, Dr. Koh, for that warm introduction. I appreciate that. And thanks to everyone who worked on organizing this event. It's great to be here because it is important to take stock from time to time of where we are, where we've come from, and where we need to be going. Dr. Koh talked about the National Prevention Council, and that's one of the many aspects of the Affordable Care Act that is promoting health, that's enabling us to address health in a different way than we've ever addressed it before in this country. For the first time ever, there's a national plan to improve health status. The Affordable Care Act puts an emphasis on prevention in many different ways. Two of them we're talking about here. One of them is the National Prevention Strategy and the National Prevention Council. Another is the Prevention and Public Health Fund. Now, the National Prevention Council represents 20 different federal agencies with a wide variety of the federal government involved for the first time ever, working together to see what can we do as a government, what can we do as a society to promote health and to reorient not only our healthcare system, not only our health system, but our society to promote prevention and public health. But also through the National Prevention Strategy to figure out new ways to both implement things we know work and to identify new things that we need to find, document, and scale up. The Prevention and Public Health Fund is the first time we've ever had a mandatory fund on prevention in the U.S., and that's because of the Affordable Care Act. The Prevention Fund enables communities all over the country to understand better what the problems facing them are, to respond more effectively to the challenges that we face, whether they're infectious, environmental, or chronic, and to prevent problems from happening by addressing the leading causes of illness, injury, disability, and death. That is essentially what the Prevention Fund enables, and some of the work that you'll be hearing about today is directly funded by the Prevention Fund of the Affordable Care Act. For example, we've been able to support work to help people who go into the hospital not get a new infection when they're in the hospital, preventing healthcare-associated infections, because no one should have to go through that. And yet it happens all too commonly in our healthcare system, despite the best efforts of healthcare professionals. And by reducing healthcare-associated infections, we can help people live longer, healthier lives, we can reduce injury and disability, and we can reduce healthcare costs. Prevention pays. Prevention is the best buy in public health, and the Prevention and Public Health Fund has been implementing new prevention programs at the national level and all over the country. We've been able to begin to address the alarming rise in diabetes, and you'll hear about some of the programs that are doing that through the Prevention Fund and other activities. And we've been able to help people who want to quit smoking. And yesterday, by chance, we announced the results of the first ever national paid campaign to educate Americans about the harms of smoking. It was called Tips from Former Smokers. Very courageous Americans came forward to share with other Americans what it's like to live with illness, disability, disfigurement from tobacco use. What they did was to help us to pull back the examination room curtain and show smokers and their families what smoking really causes. Now, it was a significant investment, but the tobacco industry outspends us in 3 days. Nevertheless, even though it's kind of like a David and Goliath fight, we're going to win this one because we've got the reality of smokers on our side. We've got the force of the Prevention Fund to amplify that. And yesterday, we announced that by the most minimal estimates, as a bare minimum, at least 100,000 people quit smoking for good as a result of that one 12-week campaign. Now, those are numbers, and, you know, I'm public health, so I'd love to give you numbers, but, and 100,000 people quitting smoking forever means, among other things, tens of thousands of people who will not be killed by tobacco prematurely. Yesterday, we invited one young woman who had contacted us, Leisha Hancock, from Kentucky, to tell her story when we released these findings to the media. It was published in the peer-reviewed publication, The Lancet, but we wanted to make sure that there was widespread understanding of why this is so important. And Mrs. Hancock shared with us that she started smoking at the age of 21. She had smoked for 17 years. She had tried to quit a few times before, but when she saw the ad, when she saw Terry Hall, the woman who is living with a tracheotomy, and described what it's like to do that, and described what it's like to get dressed in the morning, described what it's like not to be able to sing her grandchild a lullaby in the voice that she's accustomed to, Leisha was deeply moved, and she has a 5-year-old son who asked her, "Mommy, are you going to sound like that?" And, you know, she teared up when she told us that, and she quit smoking. And more than 100,000 people like Leisha quit smoking, and that would not have happened without the Prevention Fund of the Affordable Care Act. So we are seeing efforts, we're seeing progress, we're seeing victories all over the country for all sorts of communities, for all sorts of people across the whole span of life, from newborns to the elderly, from healthy living to independent aging. And all of that is possible because of the terrific work that is done by you and those like you here. Public health, because it's about prevention, is often good for society as a whole, but may not have a strong set of advocates for specific programs. And that's why people like yourselves, the champions of change, really, I think, embody the highest calling and the highest commitment to collective and societal responsibility of saying we're going to help all of society be healthier. Now, these 8 exceptional people represent teams, they represent communities, they represent families, and we're recognizing them here for their success at translating research and policy into practice, because we know that that's what leads to real and measurable impact. And we know that as the Affordable Care Act gets rolled out over the coming months, one of the key things that's going to happen with these additional aspects of the Affordable Care Act is that millions of Americans will gain access to health care. Just last week, we released a new analysis of information that looked at what's happened with blood pressure control over the past decade in the U.S., and the results were striking. For people over the age of 65 who have Medicare, there have been substantial progress. For people under the age of 65 who often lack access to health insurance until the Affordable Care Act, there was very little improvement. In fact, because the population size of the 45 to 65s have been growing, there was actually no decrease in the number of people with their blood pressure out of control, people who may have a stroke or a heart attack or kidney failure tomorrow. And as more and more people are able to get health insurance, get access to health care, we expect to see a decrease in those kind of preventable tragedies. Now, already there's been a lot of progress with the Affordable Care Act, with 3 million kids staying on their parents' policies, 3 million 19 to 25-year-olds being able to get health care who wouldn't have been able to get it before, with people not having to pay for prescriptions, with people not having lifetime limits, with people not having to pay for preventive care, no co-payment, with people not having getting a rebate from their insurance company if the insurance was charging more than 80 to 85%, less than 80 to 85% for direct health care. So really, we're seeing a growing momentum on improving health, a growing focus on prevention, a growing ability to support individuals, families, and communities. And you, as the champions of change, I think, represent many different ways that that happens in all parts of this country for communities throughout the country. So thank you so much for what all of you do, and let's give you one more round of applause. Thank you. And now I'd like to invite the 8 awardees onto the stage. I'll introduce you one at a time, and then we'll have brief comments from each. Dr. Janine Janoski, Vice President and Senior Fellow with the Center for Community Health Improvement at the Austin Bio-Innovation Institute in Akron, Ohio. Erica Washington, the Healthcare Associated Infection Coordinator for the Infectious Disease Epidemiology Section for the Louisiana Office of Public Health in New Orleans. Andrea Hayes, Director of the Movement Initiative and Upgrade Program, Wellborn Baptist Foundation in Evansville, Indiana. Dr. Marion Kaner, Director of Healthcare Associated Infections and Antimicrobial Resistance, I think that's the Antimicrobial Resistance Program of the Tennessee Department of Health in Nashville. Natalie Polenko, Director of the Office of Local Public Health and Prevention of the New Jersey Department of Health in Trenton. Miriam Escobar, Community Outreach Worker at the Moffitt Cancer Center in Tampa, Florida. Ira Combs, Community Liaison Nurse Coordinator at the University of Nebraska Medical Center and Founding Director of the North Omaha Area Health Program in Omaha, Nebraska. And last, but far from least, Dr. Elmer Huerta, Director of Cancer Preventorium and MedStar Washington Hospital Center's Washington Cancer Institute. Thank you and welcome to all of you. We'll just start with brief comments from each of you. We'll just go down, starting with Janine.
Sure, absolutely. Well, thank you so much for the opportunity to be here with you today. This is truly an honor. You know, I sit here today as the champion of change, but like all of the work in public health and prevention, it's really a collaboration. And there are many people in Summit County, Ohio, Akron, Ohio, and Northeastern Ohio that are part of our coalition, part of our collaboration for collective impact that deserves this credit and this understanding also. So I applaud all of them for the collaboration that we do. So what have we been doing in Akron, Ohio, and Summit County? Well, through the Affordable Care Act, we have an opportunity through the Accountable Care Organization to look at the way that we deliver health care, but perhaps more importantly, the way that we improve health within our community. So we have worked together with the partners of the Austin Bioinnovation Institute in Akron, as well as many other partners, to create what we call an accountable care community. So if we think about the Accountable Care Organization, and we expand that to not only be focused on those that come to our health centers and those that have payer insurance, whether that's public or private, but to be focused on absolutely everyone who lives within our community, that's the Accountable Care community. And how do we do it? Well, at the Austin Bioinnovation Institute in Akron, we have 5 what I call legacy institutions that make up the institute. These are Summit Health System, Akron General Health System, Akron Children's Health System. So 3 health systems, 2 focused on adults, 1 focused on pediatrics. We also have 2 educational institutions that comprise the founding partners of the Austin Bioinnovation Institute, the University of Akron and Northeastern Ohio Medical University. So together, they form the core of what it is that we do. But we know that health care alone does not get us good health, and health care alone does not get us wellness. So even though they are core and they are essential, we have expanded that partnership and that coalition for the Accountable Care community. So we now have over 70 organizations that work with us on a day-to-day basis in improving the health of each and every one that live in our community. Not just those that have insurance, not just those just have private insurance, but everyone. So who are these other organizations? They're Summit County Public Health, and there are social service agencies as well as educational institutions that all have a stake in an improved health within our community. So let me just give you some summaries of what we've been doing for the last 3 years. We have marked impact on improving health of individuals living with diabetes. I can share with you HbA1c values that have gone down. I can share with you obesity levels. I can share with you weight. I can share with you with the patient experience if we think about the bottom line from CMS. But I will tell you something that happened last week. Last week, we had a program, one of our programs that's part of the initiative for the Accountable Care community. And in that program, there was a woman who had shared with the leader of our program that now she understands it's important to move, and move doesn't necessarily mean going to the gym and doing the activities that she believes she can't do, being an elderly woman living with diabetes. So it's that type of impact that's so important to us. It's those stories that come our way, and it's those statistics that show us that we're improving the health of Summit County, of Akron, and of Northeastern Ohio. So I will stop there, and thank you for the opportunity.
Thanks so much. Eric?
Thank you, Dr. Frieden. Good morning, everyone. And first, thank you to the Selections Committee for the White House Champions of Change. It's truly an honor to represent Louisiana's efforts in the prevention and surveillance of healthcare-associated infections. When I first came into this role almost 4 years ago, Louisiana did not have a healthcare-associated infections program. Our program was started through Affordable Care Act funding that was given to all 50 states, Puerto Rico, and Washington, D.C., and I was fresh from Tulane University School of Public Health as a new graduate, so what I first did was look at what the established programs were doing. So I had to look to Dr. Kiner's program in Tennessee, also working with other healthcare-associated infections coordinators, and I'd like to acknowledge another HI coordinator that we have with us, Jeannie from the Georgia Department of Health. So whenever we began the efforts to prevent HAI in Louisiana, the theme from Ms. Janoski's speech of collaboration will also permeate into mine. Collaboration was evident not only at the facility level with getting nurses, doctors, administration to all work together for patient safety, but we also had collaboration at the state level with several organizations, and I'll mention them in a moment, as well as nationally with the HI coordinators under the direction of CDC. So first at the state level, what we really wanted to do was to facilitate a collaborative effort between all levels of healthcare leadership and administration to keep HAI prevention in the forefront. And as you'll remember from Dr. Frieden's speech earlier, prevention is not something that's readily recognizable, I guess, in the dollars and cents when it comes to hospitals. But we actually did the studies. We actually made the evidence-based case for prevention of HAI. We took on several hefty infections, the first being central line-associated bloodstream infections, and we followed the national template and the national trends of looking at the surveillance of those infections as well as catheter-associated urinary tract infections, surgical site infections, and some others as well. So collaboration not only at the facility level, but also at the state level. For Louisiana, we are fortunate to have the partnership with the Louisiana Hospital Association, as well as our Medicare Quality Improvement Organization, EQ Health Solutions, as well as the Association for Professionals in Infection Control and Epidemiology, which is also known as APIC. And lastly, the Consumers' Right to Know Initiative. And then lastly, of course, at the national level, working with other HAI coordinators, exchanging information. I've called Dr. Kiner and her team several times throughout my efforts to see what they're doing, exchange this information, and making sure that our patients are at the pinnacle of our efforts of prevention and surveillance. So thank you.
Andrea?
Good morning. I'm Andrea Hayes, and I represent sort of a couple organizations, actually. I work for the Wellborn Baptist Foundation, which is actually a private foundation that serves 14 counties in the tri-state area of Southwest Indiana, Kentucky, and Illinois. And I also serve as the project director for the Healthy Communities Partnership. And the partnership is really critical in the fact that it is what drives the work we are doing in Southwest Indiana across all sectors and across settings that represent lifespan efforts. And it really began, we too use the collective impact concept, which is really where you have to have a shared vision and you also have to have a backbone agency. And so for the Wellborn Baptist Foundation, it actually began in about 2007 when our board of directors realized we are really facing an incredible problem with the growing burden of chronic disease. And so at that time, our board decided it was important to start focusing our efforts, which had been primarily on health and wellness and development across the community, but to really focus on how do we get people to move more, to move naturally throughout their day, and how do we get healthy food into the hands of all of our residents. So at that time, we carved out 2 different programs. One is our HEROES Initiative, which utilizes the CDC's Coordinated School Health Model, and the other one is our Movement Initiative. And what we learned very early on is that we have to use the evidence base that exists, and we have to look at emerging trends, and we have to also create some of the evidence base. So we were lucky, really enough, to be part of the early Communities Putting Prevention to Work grant project out of CDC that was through ERA funding. We worked very closely with our State Department of Health and modeled our efforts on really what was going on across the country in healthy communities. And then most recently, we transitioned as the Healthy Communities Partnership to a community transformation grant, which really, to go back to Dr. Koh's comments, it really is about creating opportunities where people live, learn, work, play, and pray, so that they can be in tobacco-free environments, that they can have access to healthy foods, and have opportunities to integrate physical activity in their daily routine, and to have access to those really critical preventive care services. So we are just wrapping up our first year, and we're seeing some really exciting things happen with the attention that's putting on our brand new babies as early as newborns, the first year of life, getting a chance to really be embraced in a baby-friendly hospital environment. We're working in 56 schools across our 7-county region to implement more opportunities for children to get physical activity and healthy eating opportunities, despite what the physical education guidelines or the food program provides. And then we're working all the way across the spectrum to prevent readmission among our chronically ill, older, underserved adults through our Visiting Nurse Association program that really works with them to monitor their conditions at home. So we're in our first year, and we're really excited to be a part of this, and it really is a team effort.
Dr. Kainer?
My name is Marion Kainer, and I'm an infectious diseases physician and epidemiologist and direct the Healthcare Associated Infections and Antimicrobial Resistance Program at the Tennessee Department of Health. I have a privilege to work with an absolutely awesome team of dedicated public health professionals, and we work to make healthcare safer by preventing infections and reducing the emergence and the spread of antimicrobial resistant bacteria in a similar way to what Erica had described. Last year, a fungal meningitis outbreak devastated patients, their loved ones, and healthcare providers. Dealing with it required every tool in my toolbox, my training as a clinician in Australia and at CDC as an Epidemic Intelligence Service or EIS officer. More than 13,500 patients received contaminated steroid injections from a compounding pharmacy. 750 patients developed meningitis or infections near their spine. 64 have died, and many still struggle with complications. As horrendous as this outbreak has been, it could have been so much worse without recent investments from the Affordable Care Act, Prevention and Public Health Funds, but funds most members of my team. The HAI team quickly determined the cause of the outbreak, resulting in product recall only 8 days after we heard about the first case. The team identified patients not yet ill but at highest risk of getting sick. Lives were saved by halting the contaminated injections and tracking down affected patients and getting effective treatment to the sick without delay. In Tennessee, 153 persons developed infections. 16 have died. We estimate that in Tennessee alone, without public health interventions, 368 additional persons would have been injected. An additional 99 would have developed serious infections, and up to 69 more people would have died, all assuming that there were no additional shipments. Our success came from a massive team effort but required close collaboration among clinicians, clinics, hospitals, local and state health departments, and federal agencies, as well as vital funding from a Prevention and Public Health Fund. We must work together to ensure that we preserve this critical public health infrastructure and to prevent such a tragedy from occurring again. Thank you.
Natalie?
Good morning. The 95 health departments in New Jersey that serve the nearly 9 million residents in the 565 towns that is New Jersey are what inspire me every day. And the New Jersey State Department of Health, our Commissioner Mary O'Dowd, are very much committed to supporting those health departments and those professionals in doing the work that they do on a daily basis to keep our communities safe and to keep the people healthy. To that end, at the State Health Department in particular, we've undertaken a number of initiatives that leverage the technology that is available to us today and want to assist health departments in being more effective and efficient. So two things that we've done, and this is very much upstream from what my colleagues are describing. This is the documentation. And when I talk to my health department colleagues, they're like, just do it and then tell us what to do later. So something very simple like designing an access database for health departments that don't have the technological wherewithal and creating a compliance and investigation tracking system for them to use on a daily basis. Many of them don't have that. They just don't have the time to build it or design it or even pay for it. We sent it out for free just a couple of months ago, and many of them are using it now. Very important to track this kind of day-to-day work on investigations. On the more complex end, and something that I think that has propelled me to this podium together with my colleagues, is a more complex database that we're in the third year of developing, which tracks the day-to-day activities of every health department serving every one of those 565 municipalities for all 9 million people. Something that we spent a lot of time planning out and developing. It should roll out in January. It will go live. The reason that it's important is that not only does it document the day-to-day activities of public health, but it standardizes the language of those activities. It makes us paperless. I think the filing system companies in New Jersey are mad at me because they're all going to go out of business. So that's on the complex end. But the thing that concerns me the most is that public health, as described by Dr. Coe and Dr. Frieden, it's pervasive, it's everywhere. It's so foundational to keeping ourselves healthy. And yet public health continues to be so invisible. And that's what compels me in doing the work that I do. I want to make the invisible visible. And the only way that you can do that is to document what you do every single day. And we are attempting to do this, but at the same time be ruthlessly practical. In other words, collect the minimum amount of information with the least amount of burden and make sure what you're reporting out is maximally useful. So I and the State Health Department are deeply grateful to the CDC, whose National Public Health Performance Initiative through the Affordable Care Act makes much of the work that we do possible. I want to thank the White House and all the folks who went into choosing through those 900 applications for this incredible honor and I'd also like to say that I would like to accept this honor on behalf of not just the New Jersey Department of Health, but my co-conspirators at Rutgers University, the team at the New Jersey Department of Health that works so tirelessly with me, and all the hardworking public health professionals all over the country, and particularly in New Jersey, for their tireless and ceaseless efforts to protect the health of the public here and everywhere. So thank you.
Miriam?
Thank you. Good morning to all. My name is Miriam Escobar, and I am a community outreach worker at Moffitt Cancer Center in Tampa, Florida. I'm delighted to be here today sharing this table with all of you. And I'm very honored to be nominated for this recognition. I'm very proud to be here representing the work we do at Moffitt Diversity Department. I happen to be here today, but as all of you say, this is a team work. Out there is a lot of champions of change every day working with the community as community outreach workers or health educators. To let you know something about me, I was born and raised in Colombia, South America. And I came from a family where sharing is the key word. So I learned from a very early age that every day is an opportunity to help. The only thing we have to do is be aware and just use every tool the life gives us to use it in the right moment with the right people. Over there in Colombia, I have the opportunity to work with work farmers while I was living in the countryside of the country, raising dairy goats. So I knew firsthand the necessities and the challenges of the farm workers. And I didn't know at that moment, but that is something that is going to help me a lot when I came to Tampa. I came to Tampa in 2006 with my husband and my son. And in 2008, we have a terrible loss in our family. My sister-in-law died of breast cancer. She just didn't pay attention to the symptoms. So for those things in life that only God has the answer, the very next day she passed away, I was working for Moffitt Cancer Center in the department that teach the community about prevention. In 2011, I started to work in Moffitt in 2008, and I started to know in the community, and I got the guidance and the support of my supervisor, Vanessa Rivera Colon, and my coworker, Janet Palencia, who are here today with me, supporting me. I couldn't do this without them. And in 2011, Vanessa Rivera designed a program, a beautiful program we call Yo Me Cuido. That means I take care of myself. As soon as she gave us the program, we knew that we have a perfect tool in our hands to change many lives. So Janet and me, we go out with that program to the community. And the program focuses on Hispanic women as they are more likely to be diagnosed at later stages of breast cancer. Yo Me Cuido delivers community-based outreach and education to Latinas in Tampa Bay and surrounding areas to increase breast cancer awareness about early detection and risk reduction. To date, we educate more than 2,000 women, and 48% the women 40 and older had their mammograms. We go wherever it is a group of women. We go to churches, libraries, schools. We go to the beauty salons. We go to the restaurants. Wherever they are, we go. They invite us, and we go on Saturdays, nights. We just go. If they invite us, we be there with the program. And the workshop is about 2 hours, and they talk to them about prevention, healthy lifestyles, about risk factors, about symptoms, and we give them information to take home. But the most important thing of this program is that we track every one of these ladies. So we start to make phone calls to them, we send them emails, we send them postcards until we make sure they had their mammograms. We joke and we say that we are the Tampa police of the mammograms because we don't stop. We just keep calling and calling. And after 1 year they had their mammogram, we start to call again to remind that there is time to you to do your mammogram. What we learned from this program is that the community is waiting for this kind of programs. Hispanic community, the necessity is huge. So when we go to them and we say, Buenos dias, they open the door wide. They just want to hear what we have for them. So not only they heard what we have to say to them, but they share that with their families and friends. We have calls every day from women from the community who say, I didn't went to the workshop, but I need a mammogram. A friend of me told me about Yo Me Cuido. What can I do? So for us, this is our goal. Well, we want to go nationwide and then teach each one of them that if they change their life, if they take care of themselves first, they can change not only their life, but the life of the entire family. Thank you.
Hello, my name is Ira Combs. I am from the University of Nebraska Medical Center. My title is Community Liaison Nurse Coordinator, which is a fancy term for outreach, but it's like a diplomat. Initially, when they called me, they said, well, they sent me an email. I went, yeah, I get those emails all the time. And then they called me, and they says, well, we sent you an email. And I went, oh, really? I mean, so I was still, is this a trick? Where's the camera at? Because, I mean, what I do, I felt it was just what you're supposed to do. I tell people I was conceived and born and raised in Omaha, Nebraska. Didn't even leave Omaha to go to college. And I'm a non-traditional student, which means after I turned 40, I went into nursing. Before that, I was in social work. So now at 62, I'm out there working with the community, and prevention is key, because prevention, things I heard today were like, I believe that. Prevention is cheap, and if you do it right, well, no one knows. And so I work with a couple of really excellent coworkers who have the same spirit I do. One's a nurse practitioner, and she formed a group 12 years ago called My Sister's Keeper, which is a breast cancer support group. My other partner, Wayne Houston, he formed a group about 15 years ago called Black Family Health and Wellness. All these programs that we put together, they don't cost, they're not run by a big institution. They're community-driven and run. And the results from these programs that are community-driven and run are just phenomenal. We do sometimes twist the arm of big institutions and make them feel guilty, saying, your people are out here dying and you're building new buildings, so they sometimes will support us. And working for an academic institution, I have to understand there's priorities. And they hired me because I can go to the community and find out what is needed. But also I can tell a university, this is what the community needs, and you need to have programs this way. I have three emphases, really. One are little kids. I have a puppet called Dr. Jesse, and he goes out and he talks about hand washing. I'm doing a presentation at the Public Health Association of Nebraska called How to Reach Hard-Reach Groups, Toddlers, Teens, and Old-Timers. And those are the three tough groups. And what I do is I get, one of the things I do for teens is I have a program called CPR in the Hood. And we teach teenagers CPR, but the requirement is that you have to go out and teach other teenagers and other family members this. So now we have this great educational program, and it's not run by me or nothing against PhDs or anyone else up there, but it's run by a group of teens in the community. And they go out, and I think it's been really successful. The other one with old-timers, men like me, we have a special, we only go to the doctor when our leg has fallen off or we have chest pain. So what we try to do is we try to get men together in small groups where they could, coffee, and we meet at McDonald's, drink coffee, and talk about these issues that you wouldn't really feel comfortable talking about in a large group. So we're just trying to find creative ways of reaching people with health information that's not really expensive. One of the last things is we have a program. It's a 1-week workshop for teenagers, and it's run by another group of teenagers or college students that are working with us. And a young man, his name is Dupree. And when he first started, he was 17. He just turned 20. And he went to college. He became an EMT. And a question he asked me the other day was, I'm his mentor. He says, Mr. Combs, when you're gone, and who's going to take care of this? I said, I think you should. And I think the emphasis is that, especially if you're old like me, that we have to prepare, because who's going to take care of our community when I'm gone? And I think part of the emphasis is to raise up children and teenagers to understand that they're responsible for their community. One of the things when I teach anyone, whether it's little kids or teens or older people, is that after I give them information, the last thing I say is, now you're responsible to take this information out to other people in the community. And that's a real cheap program because you don't have to pay them. And then for people to get, yeah. And it's effective, but it also gives the community ownership of information. And I appreciate the University of Nebraska Medical Center putting up with me because sometimes I get really, what's the word? Passionate. Some would call it militant, but it's really it's passionate. To show them that, yeah, and I'm glad they hired me because I can be the voice saying this is what we really need, and this is this is what has made our community overall healthier by giving out this information. Yeah.
Thank you. Dr. Huerta.
Thank you. First of all, good morning, everyone, and thank you very much for the Champions of Change initiative for giving me this award. It's an honor for me and for my family to receive it. Thank you very much. I'm from Peru, and I used to be a medical oncologist in Peru 30 years ago. And while I was practicing medical oncology, I started to realize that most of the patients that were sent to me for chemotherapy had advanced and incurable disease. Colorectal cancer, cervical cancer, advanced, incurable, they were sent to me for chemo. So I started to question myself, what I'm doing here? These are preventable conditions. These are early detectable conditions. And one day, I remember in the emergency room of the hospital I used to work, this woman came in a stretcher in the middle of this pool of blood. She was bleeding through the vagina. I tried to examine her, introducing my fingers in the vagina, and I couldn't do it because the whole vagina was replaced by a huge cervical cancer mass. So when I talked to this woman and I asked her, do you know what a pap smear is? She said, well, I think that's those things that you doctors do in the throat, right? She didn't know. And examining to the same woman, just to relax her, I asked her if she knew the last soap opera that was very popular at that time. And guess what? She knew it by heart, the whole plot. That's when I decided to do one very drastic thing. I quit medical oncology. I came to the United States to pursue a career in cancer prevention and control. I realized just by that observation in that emergency hospital that this woman, she didn't know what a pap smear was, but she knew exactly what a soap opera was. And that's why, because the media was bombarding relentlessly the community with entertainment, sports, and other kind of themes, but it was a relative absence of health messages. That's when I decided to really use the media. I started to have radio programs, I started to have television shows in Peru first, and then here in the United States. And I came to this country with 3 ideas. Number one, to get a specialty in cancer prevention and control, the public health aspect of cancer. And number 2, to answer 2 questions. Would it be possible to use the media to sell health, preventative health to the community, the same way we use the media to sell soap, alcohol, or tobacco? Would people buy these concepts of preventative health if we know how to release them through the media? And my second question was, would it be possible one day to have a health facility with a sign at the door that says, this place is for people without symptoms only? If you are apparently healthy, feeling well, but you want to talk about prevention and you want to have a screening, this is the place for you. I did my MPH at Hopkins, I did my fellowship at the NCI, the National Cancer Institute, and I finished 19 years ago, finally, to study. My mother was alive at that time and said, finally, my son, you're going to get some money. You're going to work. I was hired by the Washington Hospital Center here in Washington, D.C., and when I was my interview, they asked me, Dr. Huerta, you are the first cancer prevention doctor we met. If we hire you, what would you do? I said, I would love to have a health facility for the immigrants, for the poor, for the uninsured, for the disfranchised, but I want to see people without symptoms. And they say, who's going to pay for this? I said, people are going to pay for this. Because when people, even though they are poor, they realize the positive aspect of something, they will pay for that. I said, well, let's going to try it. Well, at that time, my radio program was very popular here on a daily basis, talking about pap smears and cigarette smoking and public health issues of cancer. So when we announced this clinic to the public, we filled in 2 weeks, 6 months of appointments. The community was already sensitized, and they were ready to act. We have seen over 30,000 people in this clinic in 19 years, and the patients that come to me, they come holding hands, are a young couple, and the man talked to me, and he said, Dr. Huerta, we just got married. Would you please do the pap smear on my wife? And please also teach her how to touch her breast. She doesn't know how to do it. And to me, please teach me how to do this testicular examination that you were talking in your radio show the other day. And say, okay, anything else? Yeah, we want to have a baby. Would you please just tell us what to eat? I mean, my wife, she needs to eat something healthy because we want to have a healthy baby. You said that women who are lacking some vitamins, they may have babies with problems in the brain. We don't want that. This couple, they have no symptoms. They are paying out of pocket for the visit. They have no health insurance, and they are immigrants, and they are just looking for preventative health. So that's what we do. We use the media on a daily basis to sensitize the community. But the same heartache I got 30 years ago in Peru when I discovered that case of that lady, I just got it a little while ago in Washington, D.C. And this is probably the next stage of my life. I asked my hospital to give me some data of the advanced and incurable cases of cancer that we see here at the Capitol in the Washington Hospital Center. And guess what? There are thousands of cases of stage 3, 4 cancer cases that go to my hospital. A lot of these patients, hundreds, they live in my neighborhood in Ward 5 around Washington, D.C. And guess what? Almost every single patient, they do have health insurance. So the problem is not access. The problem is not to give a person a card for their pockets. And this is very important for the ACA, for the Obamacare. No, if we don't put together a very strong educational program with the access to care, we will not do anything. So now we are working in the hospital to go to Ward 5 and involve the community in and try to overcome this problem in the next 5 years. It is a shame that here in Washington, D.C., people with health insurance living around the hospital are going very late. Thank you very much.